All right. Well, hello everyone and welcome back. I'm Jasmine Black, one of the enrollment specialists for McKendree Worldwide. And as you know, we have been doing a video series featuring some of our awesome program directors and our student service specialists. And today I am happy to be joined by Dr. Richelle Rennegarbe. Hello, Dr. Rennegarbe. How are you?
Good morning.
Thanks for taking the time out of your busy schedule. I know that, you've had a lot on your plate with all of our doctoral candidates doing their things, right? Well, as you know, our interviews are being done remotely as we continue to flatten the curve. So if you're ready, then we'll get started.
Great. That sounds good.
Awesome. So can you tell us a little bit about yourself and the programs you oversee?
Sure, I'd be glad to. I actually am in the nursing division chair, and I'm also the DNP director for ethical leadership at McKendree University. So I love being at McKendree University. A little bit of background, I actually got my associate degree from a local community college in our area. I got my bachelor's degree from McKendree University. Go Bearcats. My master's degree is in actually community health from SIU Edwardsville, and my doctorate is in health education, and it's from SIU Carbondale. So actually have a good background then with knowing a lot about the BSN program since I'm a McKendree grad.
Awesome. Okay, so how long have you been with us? And I guess kind of how did you end up as the nursing chair?
That's a good question. I've actually been here twice. So I was actually at McKendree from 1996 to 2002, and I was an instructor of nursing at that time. And I actually left to become a chief nursing officer at a local hospital. While I was there, I got to become the chief executive officer or president of the hospital. So from 2002 to 2009, I worked in administration. So after that period of time, there was an opening to come back as the division chair, and I knew my heart was in teaching, and I wanted to come back to McKendree and teach again there. So I was hired to come back as the nursing division chair and also the master's director. So when I came back, just a little bit of background, we didn't have the doctorate at that time. So things have changed and evolved. And one of the things that I've been a big proponent for is having a terminal degree at McKendree University in nursing. So we've added the Doctor of Nursing Practice and Ethical Leadership, and I've been steering that since I've been at McKendree. And I love McKendree. My heart's here, and my goal is to retire from McKendree.
Awesome. I love it. I love it. Okay, so you have a lot of real world experience, it sounds. So how do you incorporate that typically into your lessons?
And that's a great question. Actually, the best thing that ever happened was for me to leave McKendree for that short period of time and gain the administrative experience, because it really gave me a better perspective. I think it made me a better faculty member because I have the real world experience of being a chief nursing officer as well as a CEO of a hospital. So I can bring back the stories and the experiences that I had. And in addition, since being back at McKendree, I still serve on boards. So I'm actually a board of director for the Illinois Organization of Nurse Leaders, but I'm also on a hospital board, and I'm on the executive committee where I serve as a secretary for a hospital board. So from that standpoint, keeps me very up to date about what's going on regarding quality, safety, leadership. So even now, despite the fact that I'm in education, I'm still gaining a good background to continue to teach in this area.
Gotcha. Okay, so with not only your, experience here teaching, and then kind of all the different organizations and things that you're a part of, like how has COVID-19, affected your lessons and all of those different dynamics and organizations you belong to?
You think that it would not affect us because we teach online. We do have some blended courses. We have some in Kentucky as 2 sites in Illinois. So from those folks who were in the blended format, they had to turn and become online. So there was a transition for them. Even though they had that experience, it was still different than what they were experiencing. And they've adapted very well to that. Probably our biggest challenge has been practicums. because folks have maybe not been able to finish their practicum time in their organization because of COVID. So we've been very creative about what we've done. We've looked for alternative sites that will allow students to come. We've also allowed students to do volunteer work to help with the COVID crisis, whether that's delivering meals, whether that's helping at their schools, whether it's actually working with the hospital to do screenings. We're trying to be very creative about helping them finish those practicums. In addition, projects have been challenging because they're trying to finish them in hospitals. So our doctoral students, our bachelor students, some of them have had to put things on hold or they've had to change and adapt, but we've been there to support them along the way, and they're doing a great job with it.
That's really special, and I think that's great that y'all are being so supportive and adaptable. I think that's what everybody needs, you know, especially during this time. You can still get stuff done. You just kind of have to do it in a way that maybe we didn't expect or anticipate, right?
You're correct. And that part of nursing is being adaptable. So
Yeah.
we're innovative. We know how to change to make things happen. And so we want to make sure we support our students now more than ever during this difficult period of time.
That's awesome. Well, you think the individualized attention and y'all's hands-on piece is really one of the things that makes our nursing program unique?
Absolutely. Everybody will say they have a connection with their students, but I can tell you, we live and breathe that. We really do connect with our students. We know about them. We know what they're going through right now. We know if some of them are being tested for COVID right now. We had one who's positive right now, one of our students. We support them. We know when folks have their children, when they're getting married. We really do make that extra effort to go above and beyond to really gain a partnership. And I think that's part of the reason students come back to us. Once they've had their bachelor's degree, they seek us for their master's program and even their doctorate because they know that connection. I also think we very much focus on real world experience. We are giving them what's going on currently. We're focused on evidence-based practice. We're focused on quality and safety. We really look at population health. And the big thing right now is innovation. So we are very much trying to make sure we are providing them exactly what they need to be effective in today's healthcare setting.
I love it. Yeah, I spoke with Dr. Albers the other day, and she was talking about population health because I know one of the questions I get often, you know, is what is population health? So she kind of elaborated on that. And I think, you know, this mindset and this challenge, I think that nurses, you know, have been given about pretty much creating preventative care and kind of thinking out the box and all that kind of stuff is essential to, you know, our next step and really taking care of us from a health perspective, you know, beforehand, before you end up having all these crazy things that we could have prevented. So I think it's awesome that that's something that y'all are incorporating at every level, you know, from undergraduate all the way to the doctoral program. So speaking of that, so tell me about some of the interesting courses, you know, that you all have woven both into the BSN and the DNP.
From us, we really try to build on coursework in the RN to BSN. So when we do that, we make sure we give you the fundamentals with the patho and health assessment, but we really do focus on research and evidence-based practice because a nurse who is looking at having a bachelor's degree needs those skills to be able to incorporate evidence-based practice at the bedside. They are the key to making sure that happens. The other thing, as we talked about with population health, is community. And so we make sure we give them a good foundation because there's such a shift from hospital setting to the community setting. So that's a big focus in the RN to BSN. But the most important and the capstone coursework is in leadership. We really do believe that we are making sure we educate the future nurses in our communities. So we give them a good, strong foundation in leadership, skills and quality and safety so that they can lead others in their organizations.
I love it. Awesome. Well, for the DNP, I know we have a whole admissions process, but during that process, I know that we have interviews. So what are you really looking for in an interview, or what can someone expect, I guess, when they speak with you or one of the other folks within the Division of Nursing?
Well, when we do the interview for the DNP, it's really an opportunity to form that initial bond for us to get to know the individual and what do they want to gain from the DNP program? Why did they choose to get that DNP? That's really a big decision to make to do so. So we want to know why they made that decision. We also, our big focus in the DNP is strengths. We actually use the book Strength Finders 2.0, and we focus on the individual's strengths. And that we don't look at what you're weak in, we look at what you're strong in. And so part of it is finding out what can we do to build those strengths so that you're successful in the DNP. Likewise, we also want to know what are your areas of interest so that we actually partner you with the right mentor. So some of us have education background, some of us have population health, some of us have management, but we want to put you with the right mentors and the right team to be successful. So part of it is finding out what is your area of interest and even potential ideas for your DNP project. So really the interview is an opportunity for us to get to know the student and for us to start building that partnership.
Gotcha. That foundation. I think that's fantastic, especially that you all are thinking about that at such a early stage. So kind of, I feel like makes it a little more customizable for the student. And I also think shows how invested you all are into them. So I love it. So I know there are great things on the horizon for the Division of Nursing right now. Is there something awesome you'd love to share with our viewers?
I would love to. We are looking forward to launching a Master's in Health Administration. So we have never had an MHA. Yeah, we're excited. And it's actually going to be housed in nursing, in the Division of Nursing. So are the School of Nursing and Health Professions. We have found there's a great need. We find that our MBA students may have an interest, our MSN students may have an interest, but we also have athletic trainers and we have health ed people, our graduates, who may have an interest. We also have a really strong partnership here in Illinois with the Illinois Critical Access Hospital Network. It's 53 hospitals that are critical access. And they have actually indicated that they have a need for their leaders within their hospitals to have a master's in health administration. So we are thrilled to be able to launch the MHA. So actually, we'll also be looking at an interdisciplinary collaboration. So two of the courses will be dual MHA courses. Three of the courses will be MSN MHA courses. So students will get an opportunity to actually work with others in the field of healthcare or business. And then 5 of the courses are going to be specific to MHA. Our goal in the future is to offer postgraduate certificates for MSNs and MBA students so they can come back and get that concentrated information or certificate in the Masters of Health Administration. So we are thrilled. We're looking forward to it. And please feel free to contact me if you have any questions or if you have an interest in the MHA.
Awesome. I love how inclusive that program is going to be to kind of incorporate a lot of different disciplines. And I think also expose the students to kind of different students as well with different interests. So I'm super excited for it. I know it's something that, me being out and about often that people ask for. So I know that they'll just be enthralled when they know we have it. So congrats on the new one.
I'm going to put you to work. I'm going to have you out recruiting for us in the very near future as soon as we can get this situation behind us with COVID.
You got it. Well, so you alluded to some of the cool projects your students do. Do you want to tell us about a few that either some are doing now or some have done in the past?
I would love to. Probably one of the most interesting ones we had this semester that our graduates is they developed an escape room. So the escape room was for new graduates who were coming in to learn about the organization, and the way they escaped was by solving the information about new employee orientation and about new skills for their department. So it was an awesome project, well received. The students loved it. Another one we developed was a sepsis toolkit. And sepsis is a really frightening disease that can have really bad outcomes for patients. And one of our DNP students developed a sepsis toolkit to be used in all the critical access hospitals here in Illinois. And yet another one was one of our DNP students developed an education module about autism, and that we could train the nurses to be better prepared for caring for patients who come in with autism and making sure we meet all of their needs, not just physical, but psychological, spiritual, and even the things that would be important to them and their family members so that they get the best care possible. And so her project focused on making sure nurses were better able to help autistic patients.
Wow, those sound fantastic. I bet that is a joy to kind of watch and see those things kind of come to fruition, as an instructor as well.
Well, and I think people think it's going to take such a long time for a DNP. They're done in 5 semesters. So these students started just less than 2 years ago, and in 5 semesters, they've developed, they've finished their coursework, they've done this project, and it really is, you're so proud of what they've done and how impactful it is for the community. And again, these are our leaders in organizations. And we see everyone from chief nursing officers. We have folks who are leaders in public health. Right now we have a CEO from a hospital who's in our DNP program. We've had corporals from the military. So we've had a wide range of leaders in our DNP program. And to see these projects come to fruition is absolutely amazing, both for the student, but also we are so proud of them and what they're able to accomplish as well.
Well, I got to take a second to brag on you and your instructors too, because I think you all do a fantastic job, with how you have everything set up. I mean, with online instruction, I think sometimes people can be a little fearful that you don't have that personal touch, or that you're not necessarily going to get to know your fellow classmates. And I think you all do a fantastic job at creating different kind of modules and different things that are really interactive and that really create that bond, even though the students can be miles apart, and you all just see them, oftentimes the one time a year for the immersion. So I think that that's really a testament, to what you all are doing also. So
thank you. Thank you.
Oh, you're welcome. You're welcome. Yeah. So I feel like I probably know the answer to this question, but what is your favorite part about working for McKendree?
Oh, it's the students. You really think about it. You think, what are we giving the students? It's not that. It's what I gain from them. Every cohort, every group, you learn something, and it is so invigorating because you gain so much from them. You learn about what they're doing in their organizations. You learn about the innovations. You learn about the challenges. And I really think it's so reciprocal because we gain from each other. And the students within the cohort, they have nurses who may be even abroad. We've had students in Estonia. We have students in Kentucky. We have students in Missouri, Indiana. We've had students in Alaska or Texas. And so it's not that we have a small little world. It really takes them out of their organization and shows them the big picture, if that makes sense. They learn so much more about what others are doing, and maybe they feel like they're in a silo and these things only happen in their organization, and they learn that's not the case. It happens other places. Or they gain a really great idea that they can take back to their organization to make changes. So for me, it's so fulfilling. I love my job. I love what I do. I hope it shows because it means the world to me. And like I said, I am in my dream job.
That's beautiful. Well, do you have any words of wisdom or any advice you'd like to share for anybody that's thinking about joining one of our programs?
My big thing is make the leap of faith. People sit on the fence and go, I don't know if I should do it. I don't know if now's the right time. Maybe I shouldn't do it. Maybe I'll wait. Make the leap of faith. We're here to help you be successful in your nursing program, whether it's the RN to BSN, whether it's the master's, whether it's the DNP. We want you to be successful. And so it just takes making that decision to come and start the coursework. Once you're here, you're going to love it, and you'll be so glad you made that decision. So come on, make the leap of faith and come join us at McKendree University.
That's right. It's been stamped and approved by Dr. Rennegarbe. So if she said it, you got to come do it.
Exactly. And if you've been out for a few years, now's the time to come back. And I know it's a challenging time right now with COVID, but we need strong leaders. We need you to have the skills to carry us through times such as this and to carry us into the future. So now is the time to make sure you have the skills and the abilities to lead in the future.
That's right. Well, thank you, Dr. Rennegarbe, for again carving out, some time to chat with me and our worldwide viewers. I know I appreciate it, and I know this is great information for anybody thinking about our programs to mull over. And I mean, obviously, you can just see the passion that exudes from you. So take that as not only is she that way, but we're all that way at McKendree. So keep an eye out for our next videos. Check out the ones we've already posted. If you haven't followed us, follow us. And especially during this time, as always, stay safe, stay healthy, look out for one another, and we'll see you next time. Thank you.
Thanks for spending time with me. I appreciate it. And please, again, whatever we can do for you at McKendree, we're here for you.
You got it.